Thank you very much. You haven't got slides from me, but I'm going to stand here anyway because it's easier at this height. Good morning. Thank you, Val and Hilary, and good morning, everyone. It's a pleasure to be with you. I've got 10 minutes, so this will be a bit of a whistle-stop tour through the problem and the plan in relation to child sexual abuse. And my apologies in advance, I do need to scamper off as soon as I've finished. But I'm very pleased that Graham Ritchie, our Principal Policy Advisor, sorry, going to put you on the spot, for child sexual abuse is here in the audience. He's just waved. Do grab him, please. He's here for the morning only to discuss what we're doing in the Office of the Children's Commissioner. So, child sexual abuse in England, the problem and the plan. Well, I think we all know that there is a problem, but we're not always entirely clear as to what that problem is. So I want to say something about that and to describe the problem as I see it and to set out something about the plan in relation to what is taking place and indeed what needs to take place. So child sexual abuse exists. I think everybody is more alive to that than ever before, and I include child sexual exploitation within that definition of child sexual abuse because it is a permutation in a sense really of child sexual abuse. And I think part of the problem is that people have only woken up to certain types of child sexual abuse and are still in denial about some. So let me just list for you what I consider to be some of the problem, really. Particularly those aspects that we have woken up to, but I'll say something, of course, about those aspects which remain really rather hidden and about which there is still considerable denial. So child sexual exploitation, I am enormously pleased, of course, that the country has woken up to the issue of child sexual exploitation. Our own inquiry was instrumental in that. And one of the concerns we then developed was that people seemed to be believing that this was the only form of child sexual abuse that was taking place. It is happening on a significant and substantial scale, and I'm afraid it is not all that is going on. We looked into child sexual exploitation in the context of gangs and groups, but of course there are lone perpetrators out there. What I've called also roving males. We are, of course, acutely aware now of the issues of lone perpetrators such as Jimmy Savile. There are concerns, of course, around Cyril Smith. Others have just gone to prison. But again, my concern is that in terms of a problem, people are seeing these as isolated incidents and they are not recognizing the systemic nature of what is going on. Peer on peer, there is absolutely no doubt that there is still denial about the range and extent of peer on peer sexual abuse that is taking place. The University of Bedfordshire did a very, very powerful and indeed at times harrowing report for us on peer sexual exploitation within gang-involved neighbourhoods. That is not the only story. We are very clear that our evidence was that children are being sexually abused and exploited by other children right the way across the country. This is not confined to gang-involved neighbourhoods. It has a particular model, a particular degree of violence and fear in the gang-involved neighbourhoods, but that is not all there is, and there is still considerable denial about the amount of peer-on-peer sexual abuse and exploitation that is taking place. Including the fact, in terms of the denial, that we do not have mandatory relationships and sex education taking place in schools. And then, of course, sexual abuse within the family. The NSPCC's evidence is that 90% of reported sexual abuse is actually taking place within the family, and the vast majority, 47%, of those who are abusing children within the family are the natural father. So, again, we should not be diverted by the cases of celebrities into thinking that that is all that is going on. The other problem is that I fear there is a notion that somehow this is all in the past and today is another story, and if we can only get to grips with the past, then we will have dealt with it, and of course that is not the case. So in terms of the way in which I conceptualize it, I see that Val talked about culture within organizations, as well as the wider culture that we inhabited. So I think that there are different levels at which this is taking place and through which we need to be addressing the problem of child sexual abuse. Cultural, societal, at the individual level, both child and perpetrator level, of course, and as a public health problem, because this is, I believe, a public health problem. In terms of problems still, we are facing professional barriers. Our own research entitled Recognition and Telling into the barriers that children face in being able to talk about their abuse, particularly adolescents, is firstly and foremostly the barriers that the professional agencies put in their way. There is still a significant blindness around the realities of child sexual abuse in all its permutations. There are other forms of blindness. We just published a rapid evidence assessment conducted for us by Middlesex University, scanning over 57,000 different documents, research papers looking into child sexual abuse. And that evidence appears to be that people who abuse children primarily come from deprived and disadvantaged communities. And my concern about that evidence is that there is research blindness out there, that people are looking only in those communities and not looking at sexual abuse within more affluent and educated parts of our society, where we know, of course, that children are victims too. Other things that get in the way are shame, of course, the climate and culture of disbelief, and quite frankly, despite what's going on at the moment, I'm not confident that we've got past the culture of disbelief. I still think that there is a climate of disbelief around intrafamilial child sexual abuse. And then, of course, the significant issue of the treatment of victims and witnesses. The Crown Prosecution Service, under the present DPP and the former DPP, are determined to do something about this, and headway has been made, but it is distressing to still hear the stories of victims and witnesses in court who talk about their re-traumatization within the court arena, which is simply not good enough. So all in all, in terms of the problem, I think we can sum it up as an abuse of power. It's an abuse of power at multiple different levels, right through to an abuse of power when a child is standing up, brave enough to be a witness in court, and is abused again within that process through the defense attorneys. I'm going to then say something about the plan, because I'm very conscious of time and there's a lot to get through today. Val mentioned the inquiries. There are a plethora of inquiries. We have launched our own inquiry, which in fact, I have to say, was planned in some significant and considerable time in advance of the current brouhaha that's taking place around inquiries. Our inquiry is specifically into child sexual abuse linked to the family environment, and we are covering forced marriage within that context as well, because of course where a girl, child, or boys, we have come across through the CSE inquiry, a boy who was, at least one who was threatened with forced marriage, so boys can be forced as well. Where a child is placed into a forced marriage, what ensues is rape within the family environment. So we are looking at all of that, and we are going to hold fast to that, because, as I say, there is a danger that people will forget the fact that most children who are sexually abused are abused within the family environment. So what we are looking at in year one is primarily prevalence. What is going on? We're going to draw on all our experience from running the child sexual exploitation inquiry to get to the reality as much as anybody can about the scale, scope and extent of child sexual abuse linked to the family environment. And then in year two, we are going to be looking at what needs to be done. Where is the good practice? What do we know from the international research and evidence about good practice? There is some good practice in our own country as well, of course. We will be drawing on all of that and pointing the way forward, because a solution there must be. And the solution must be at those different levels that I mentioned earlier: cultural, societal, individual, and of course the public health level. And above all, we have to go for that golden, that pot of gold of prevention. One of the things we know is that most perpetrators of child sexual abuse are themselves abused before the age of 14. Therefore, getting to grips with child sexual abuse, particularly within the family environment, but of course right the way across the piece, is the very best way to prevent the ongoing saga, terrible trauma of child sexual abuse. Identify those people early and provide the right recovery programs, treatment programs for the victims and anybody who is then perpetrating, to make sure that we can stem this tide, because stem the tide we must. We also know that the vast majority of those who sexually abuse children are male, but there are female abusers out there, and what we know is that where females, whether girls or adult women abuse, it is because they have been subject to even more extreme abuse than their male counterparts. So that's really where we are at with both the problem and the plan. We have to have a plan. I await with interest all the other inquiries that are unfolding, but it is absolutely desperately important, and I'm using the word desperate on purpose, that we hold on to the issue of intrafamilial child sexual abuse. Do not let it fall off the agenda ever again, and make sure that we support those children and young people. So some of the things that we will be doing in the Office of the Children's Commissioner, gathering the views of children and young people. We're particularly concerned about those from black and minority ethnic communities and disabled children and young people who are too often even more ignored in this process. We will be looking to do things like utilising our powers to best effect, so that actually we can draw down records. We want to look, for example, at records of children who have child protection plans under multiple categories, but not necessarily sexual abuse, and find out whether the sexual abuse has been missed. We have the power to do that. We are working with Public Health England around changing attitudes, and we are desperately important to ensure that there is support for victims and survivors, and we'll be working with all the agencies to ensure that. And we are just about to appoint the organisation to run our Senior Hiami pilot, which will be taking forward a new approach to child protection, particularly in the first instance around sexual exploitation. We are, I believe, at a watershed moment. It is so important that this conference is happening, and it's great to be with you all, albeit briefly, because we do have to grab hold of this moment. I think there is almost a crisis going on, and crises can be turned to good use, really. We have to grab hold of this moment to make sure that we do not go into a post-Cleveland situation where people enter into denial yet again, but make sure that once and for all we face up to the realities, we identify what needs to be done, and we move forward together. In a focus group in which Graham was involved with adults who are survivors, one of them said, "It's a lonely journey." It should not be a lonely journey again. There will always regrettably be some children who will be sexually abused. We have to prevent as many as possible entering that lonely journey, but where some do, it mustn't be lonely again. We must stand fast with them, around them and beside them, and make sure that we walk forward together and grab hold of the opportunity to deal with this now. Thank you very much.